Welcome back, direct support professionals, service providers, and families. In today's short video, I want to go through the topic of quarantining. What does it mean? How do you do it? And why is it important? As a healthcare professional, and for many of you as families and as direct support professionals, you may well be called upon to quarantine. This occurs when a healthy person contacts an individual with COVID-19 or who is suspected of having COVID-19. In these cases, we generally advise the direct support professional or family member to undergo a 14-day period of self-quarantine. These recommendations from the Centers for Disease Control help to ensure that, to the best extent possible, we don't inadvertently infect our colleagues, our families, or the individuals we serve. There are two different terms that are important to understand. Quarantine refers to taking an individual who is otherwise healthy, but who may have been exposed to somebody with the coronavirus, and isolating them to prevent the possibility that they could have the infection and spread it to others. Isolation is the second term, and that is different. That refers to taking an individual who has COVID-19 and removing them from the general population to prevent healthy people from getting sick. So again, quarantine is when you take a healthy person and remove them to prevent the potential spread, and isolation is when you take a sick individual with COVID-19 and put them in a separate setting. So let's go through exactly what you need to do if you're faced with a situation where you're told you need to quarantine. At the present time, when we're talking about the coronavirus and COVID-19, quarantining usually is something that is done for a period of 2 weeks or 14 days from the time where you have potentially been exposed to an individual with COVID-19. Once you're asked to quarantine, you want to do the following. First, you want to place yourself in an isolated setting, removed from the general public, and to the extent possible, somewhat separated from immediate family members. This is most commonly done in an individual's home, although it can be done in a living environment provided by an employer if that's available. So in the case of some direct support professionals, a service provider may offer an empty house that is used to quarantine individuals. In other situations, it is done in your own house. The key thing here is to have as little contact with people as you can. So what does that mean? First, you do not want to leave your house for the period of the quarantine. That's really important so that you do not potentially expose others. If you absolutely must leave your house, then it is critical that you have a mask on and that you remain distant socially from other individuals. But again, the recommendation is that you remain at home. Within your own house, if at all possible, You try to limit contact with family members, your spouse, your children. The best way, ideally, is for you to have your own bedroom, own bathroom, and just keep yourself apart from family if you can. Number 2, really important that when you are in quarantine, you make sure to clean all contact surfaces that you encounter, doorknobs, countertops, bathroom faucet handles, anything that you touch or that is a surface that could harbor the virus, you want to clean with soap and water and then use some form of disinfectant. The third thing that's very important when you're in quarantine is to use a mask. You can use a cloth mask if you're at home. You want to make sure that whenever you're in proximity to any individual in your family, you have a mask on. The fourth thing you want to do is to check your temperature twice a day. This is very important. A lot of individuals may not have symptoms that they notice, but may start to run a low-grade fever. So it's very important to check your temperature, and the recommendations are twice a day. The fifth thing you want to do is be very alert to any of the warning signs for the development of COVID-19. Those would be cough, shortness of breath, fever, chills, shaking chills, muscle aches, sore throat, headache, or loss of the sense of taste or smell. Now again, these are very general symptoms, and because you develop one or more of these does not mean that you have COVID-19, but it is something that you want to be alert for. It is difficult to quarantine oneself. There's a pretty significant sense of boredom. You feel removed from your family, and it's just not a lot of fun, but it is something important to do and do properly if you're in that situation. I have many staff that work with me that have undergone quarantine and then come back to work and are completely fine. But it's the smart and prudent thing to do if there's a chance you've been exposed to somebody with COVID-19. So let's go through the situations where you might need to or be asked to quarantine. You may get a call from your supervisor indicating that an individual that you worked with recently either has COVID-19 or is suspected of having COVID-19. If you had significant exposure to that individual, then there is a risk, a chance, that you too could have contracted the virus. Again, in most cases, people do not get it just if they happen to be exposed, but it is important to recognize that if you've had direct exposure that's significant, then there is the potential for contracting COVID-19. So if your supervisor calls and tells you that you've been exposed, there may be one of two things that are recommended. In some cases, direct support professionals will be asked to self-quarantine, in which case they will be sent home from work and asked to remain away from work for 14 days. In other cases, you may be asked to quarantine, but you may be permitted to work with appropriate protective equipment, appropriate protective personal equipment, in which case you may be asked to work, but then quarantine when you're not at work. So this means you would come into work, you would use your mask, your face shield, gowns and gloves, and then when you were not at work, you would quarantine either at home or in a house provided by your service provider. Also, very important is to recognize when you may need to quarantine and when you need to bring that to the attention of your employer and a supervisor. Let's say a friend calls you up and says, "Hey, I just tested positive for the coronavirus." And you, as a direct support professional, know that you've been in contact with that individual recently. It's absolutely essential that you speak with your supervisor and make a determination whether or not you need to quarantine. Remember, you don't want to just come into work, go into a residence, and potentially expose the individual and all other DSPs. Equally important, you don't want to expose your children and your family. So if you've had close contact with somebody who either has COVID-19 or who may have COVID-19, you have to ask the question and discuss with your supervisor and healthcare provider right away, do I need to quarantine? If you're in doubt and you're not sure, it is always smarter to start quarantining yourself until you can clarify. The CDC has relatively clear guidelines that indicate which people, under what circumstances, need to quarantine. These guidelines are based on a combination of factors, but in its simplest form, they boil down to how close physically were you to an individual who is infected? How long were you exposed to the individual who is infected? And what type of equipment, personal protective equipment, if any, were you wearing? These three factors will determine whether or not you need to quarantine. Thank you, and I hope again these videos are helpful.